Hi. Okay, so I'm just gonna kind of suture a video together. Yesterday, I started testosterone therapy, and I'm 47, and I have a history of cancer. So this is all doctor supervised therapy. I'm not going to use any of the slang terms or anything like that. I did recently learn them, but for the sake of my video, it was testosterone, and it was an injection, an intramuscular injection, long needle. I was fortunate enough to have a client who was where I was, and she's an RN, and she actually talked to me through my first shot. We took a video of it, so I'm gonna edit that into this video, hopefully, and you guys can see what that all entails. And yeah, I'll go into my journey for cancer in another video. It was a long journey, and it was a very painful one, so I'll deal with that another time. But it's time, you know, to start. And again, doctor supervised. This isn't just you know, gym bunny kind of therapy. It's you know, for my health. So you can watch the video. It's not that great, but I did actually do the shot into my leg, vastus lateralis. That was a goal. But anyways, have a look.
Syringe out first. And then you open the package. You don't want the needle to like touch. You don't want that end to touch anything. And you're gonna screw it on just like that. Okay. So there's your needle. This is just a guard, so we don't even care about it right now. So we're just gonna pull that off like that. So I'm gonna snap this off. I don't need to swab this because it's clean right now. So I'm gonna draw back to 1/2 ml because that's your dose, right? So that's just because if you put 1/2 ml of air in, it's gonna be easier for you to get the solution out. So you're holding it like this. So you're putting the air in, and then you draw back. It's easy. And like you can draw back even more. It's gonna come in. See how it just kind of fills, and there's air at the top.
Yeah.
So I'm gonna push that air back out. So all the way up until I'm up that 1/2 ml. And it's the bottom. It's the top of that little marker. So that's 1/2 ml. Can you see that?
Yep.
Okay. So then this is gonna come out like this. So you can even put the guard on now if you want. There. Okay. Because we're gonna change the needle. So now I'm just gonna take this off, unscrew, there, get your needle ready. My shitty nails. And that just, it's like a 1/2 turn basically.
Okay.
So I suggest that when you give it, you sit down.
Okay. That's all alcohol. That's acetone.
Yeah, which
That-
is more
that'll-
acidic than.
That'll
Okay,
work.
so I want you to extend your leg a little bit. There you go. So I'm just gonna swab the whole thing because you're gonna mark it yourself. So when you go to give it, so I suggest sort of holding your leg, doing a little stab like this. Ideally, what you want to do is you want to aspirate the needle. So you draw back,
Okay.
and if there's any blood, then you don't give it.
Go to a different spot.
Right.
Okay.
So if it's all good, then you just push it in and then
Okay.
pull straight out.
Okay.
So most of the time your muscle is big. It's gonna be pretty rare that you're going to aspirate blood. So it's just a quick poke. Aspirate if you can, probably not. And just push it through. You don't have to go all the way down to the hub. You just want to make sure that it's in there.
Okay.
Like you don't have to sit there and jab all the way through.
Okay. I understand.
You want me to give you the first one?
No. I think if I don't do it myself, I'm never gonna want to.
Okay.
So, yeah, I know.
And push.
Okay, so I'm gonna get you to film me. Okay, so my leg is relaxed.
Yeah.
This is the muscle
Yeah.
we're going into right there.
Yeah. So me touch. So take the end off the needle. There, good. Yeah. Oh, my hand's in the way of the filming. There. Yeah. Wiggle your toes.
That is the muscle that I'm trying to grab.
Yeah.
Right
Here,
there.
just relax your hand for a second. Yeah. So you can feel like all that is muscle, or you know that is. So, yeah. There you go.
Okay, and then jab.
Quick. Yeah. 1, 2, 3. Oh, good job.
I didn't aspirate.
That's okay. Push.
That's in a long way. Holy fuck.
Yeah. So then put that guard over the top.
Oh, this thing.
Yeah. There you go. In there.
Okay. God.
Oh, sorry. I stopped filming. I'm a terrible. Don't ever get me to film anything.
No, it's still filming. Yeah.
Oh, okay. Well, I think it was mostly my hand maybe film.
Yeah, no, that's okay. I got the important information.
Yeah.
Okay.
And just a little pressure.
Okay.
See, it's hard to aspirate on yourself.
Yeah.
To do that.
Okay. Yeah, shut that. I'm gonna maybe do another one. I'll see if I can get her to kind of do it from start to finish herself, just so you can see how it should be done properly. Aspirating the needle on yourself, I guess, takes a little bit of practice, and it seems to be recommended, but I was not successful. It's a long fucking needle. Wow, I really didn't realize that. And it's 2 needles, one to draw the testosterone out of the little bottle there, and then a second needle for injection. The one that you draw from is a larger size needle, and the second one is a smaller diameter needle. And she says the reason you don't do one needle for both is the draw would be much slower, and she says that when you're piercing that top, it does dull the needle technically, and so it's better when you're injecting into yourself. It's a brand new fresh needle. It did go in really easy. I was a little shocked about that, and yeah, it was gross. I'm gonna try to overlay a picture of what it looked like afterwards, because I did not do a good job. It definitely looks like someone who's doing a shot for the first time did it. It's better today. Yeah, so day 1, and I have to do 2 shots a week, 50 milligrams each time, and that's going to be for the next 10 weeks, and then he's going to reassess, my doctor. So yeah, nothing like feeling old when you need testosterone. Okay, thanks for watching.